Welfare is a type of government support intended to ensure that members of a society can meet basic human needs such as food and shelter. Social security may either be synonymous with welfare or refer specifically to social insurance programs, which provide support only to those who have previously contributed, as opposed to social assistance programs, which provide support on the basis of need alone. The International Labour Organization defines Social Security as covering support for those in old age, support for the maintenance of children, medical treatment, parental and sick leave, unemployment and disability benefits, and support for sufferers of occupational injury. More broadly, welfare may also encompass efforts to provide a basic level of well-being through free or subsidized social services such as healthcare, education, vocational training and public housing. In a welfare state, the state assumes responsibility for the health, education, and welfare of society, providing a range of social services such as those described. The first welfare state was Imperial Germany, and charities. A right to social security and an adequate standard of living is asserted in Articles 22 and 25 of the Universal Declaration of Human Rights. In the Roman Empire, the first emperor Augustus provided the cura annii or grain dole for citizens who could not afford to buy food every month. Social welfare was enlarged by the Emperor Trajan. Trajan's program brought acclaim from many, including Pliny the Younger. The Song dynasty government supported multiple programs which could be classified as social welfare, including the establishment of retirement homes, public clinics, and paupers' graveyards. According to economist Robert Henry Nelson, the medieval Roman Catholic Church operated a far-reaching and comprehensive welfare system for the poor. In the Islamic world, zakat likewise. In Jewish tradition, charity is a matter of religious obligation rather than benevolence. Contemporary charity is regarded as a continuation of the biblical Maser Ani, or poor tithe, as well as biblical practices, such as permitting the poor to glean the corners of a field and harvest during the Shemitah. There is relatively little statistical data on transfer payments before the High Middle Ages. In the medieval period and until the Industrial Revolution, the function of welfare payments in Europe was achieved through private giving or charity. Through numerous confraternities and activities of different religious orders, early welfare programs in Europe included the English Poor Law of 1601, which gave parishes the responsibility for providing welfare payments to the poor. This system was substantially modified by the 19th century Poor Law Amendment Act, which introduced the system of workhouses. It was predominantly in the late 19th and early 20th centuries that an organized system of state welfare provision was introduced in many countries. Otto von Bismarck, Chancellor of Germany, introduced one of the first welfare systems for the working classes. In Great Britain, the Liberal government of Henry Campbell Bannerman and David Lloyd George introduced the national insurance system in 1911, a system later expanded by Clement Attlee. Modern welfare states include Germany, France, the Netherlands, as well as the Nordic countries, such as Iceland, Sweden, Norway, Denmark, and Finland, which employ a system known as the Nordic model. Esping Anderson classified the most developed welfare state systems into three categories: social democratic, conservative, and liberal. A report published by the ILO in 2014 estimated that only 27% of the world's population has access to comprehensive social security. The World Bank's 2019 World Development Report argues that the traditional payroll-based model of many kinds of social insurance are increasingly challenged by working arrangements outside standard employment contracts. Welfare can take a variety of forms, such as monetary payments, subsidies and vouchers, or housing assistance. Welfare systems differ from country to country, but welfare is commonly provided to individuals who are unemployed, those with illness or disability, the elderly, those with dependent children, and veterans. Programs may have a variety of conditions for a person to receive welfare. In developing countries, formal social security arrangements are often absent for the vast majority of the working population. in part due to reliance on the informal economy. Additionally, the state's capacity to reach people may be limited because of its limited infrastructure and resources. In this context, social protection is often referred to instead of social security, encompassing a broader set of means, such as labor market intervention and local community-based programs, to alleviate poverty and provide security against things like unemployment. Prior to 1900 in Australia, charitable assistance from benevolent societies, some